Hi everybody. So what we want to do here is review a quality improvement article and get it into the evidence table. But first I just want to talk really quickly a recap on quantitative and qualitative research. Research is different than a QI project. So quantitative, just remember, it uses statistics and numerals. It uses research questions and hypotheses to guide the research study. It's objective, concrete, and measured. And the goal of quantitative research is it's replicable by anyone. That is called external validity. So not only can we repeat it, but we can utilize the results and apply them to any population. Qualitative, it uses words and themes. So the researcher interprets the data to form themes. And there's many strategies utilized to ensure that it's trustworthy, credible, and etc. This is subjective research. Very important though, and it is research. So QI is different than research. Research is a systematic investigation, including research development, testing, evaluation, and it's designed to develop or contribute to generalizable knowledge. And really, you can just think of research as creating generalizable knowledge, and that's why it's so important to disseminate it. QI is a systematic, data-guided activity, and it's designed to bring about immediate improvements in the healthcare delivery in particular settings. So whereas research is really more of a generalizable to multiple populations, QI is really developed for the local setting. Okay, so IRBs, sometimes this gets a little confusing. Research and QI can overlap, and there are certain things where it will overlap, but it's still called a QI project and not a research study. IRB, so there are federal regulations that require human subject research to be reviewed and approved by the IRB, and usually, and this is a definition right from the NIH, but while strictly QI activities do not require IRB oversight, because with QI projects, there's really no intention to develop or contribute to generalizable knowledge. So that term again. But with that being said, healthcare entities still have to approve, whether you call it an ethical review committee or a QI committee, whatever, they still have to approve these projects. Now, there are times when the IRB or when a QI project kind of crosses over the line and it needs to get true internal review board approval, and that is when certain methodology is utilized, such as randomization, or funding comes from the NIH or HRSA or something like that, or when the risks from the interventions to participants, in particular patients, are greater than minimal. This is a website you guys have on your, let's get there, module. And this really is a great one. It's CHOP. It's the Children's Hospital of Philadelphia Research Institute, but it really gives you a difference between QI improvement and research. What is QI? Oh, and these are the definitions, actually, that come from NIH. They came from here that explain what they are. And then here's the differences. So how does QI differ from research? And it goes right there. And when IRB approval is needed for QI activities. So anyways, this is very important information, and you might want to take a look at it when you not quite sure. Okay, so remember this evidence table: citation, purpose, design, sample setting, major variables, measurement of the variables, data analysis, finding, appraisal of worth, and level of evidence. So I chose an article here to look at. It's a QI project. And how do I know? Well, the lovely thing is this title does talk about it. And sometimes it is hard to tell. So if you need help, make sure to ask faculty if you need any help to discern if it is a research study versus a QI project. So I know I'm going through this very quickly, but again, the abstract, it gives you the lowdown on what's going on or what they're trying to achieve with this study, and also with the results. So oftentimes, if we wouldn't have known that this was a QI project just by this title, sometimes people will look at this and they'll see statistics and it's like, oh my gosh, this is a quantitative study. But in fact, QI projects have findings as well. They have to have findings so we can see what we need to do in the local setting if we need to change something or whatever. But that doesn't mean that it is a research study. Okay, so this study, as I go through the introduction, love introductions, this is just a note, this is the literature review, this is how it is integrated into an article. All articles should have lit reviews or backgrounds. So this tells us what they were doing. It's locally, again, it's a local endeavor, and it tells us the purpose of this project was to overcome nursing barriers and improve adherence to the ICU mobility by developing and implementing a specialty-specific evidence-based ICU mobility training program. And I love this because they have a clinical question right here. And clinical questions are a big key as to, wait, this is a QI project. Because, again, remember, research studies are driven by research questions and hypotheses, okay? So this tells us the methods. This is a really nice article. It tells us the methods. This did not actually go through IRB review, but it went through their evidence-based practice committee and their QI committee. So that's something there that gives you a hint. This is a QI project. It talks about the key terms that it wanted to let us all know, the barriers that define those. And I'm going through this fairly quickly. This is kind of cool. It talked about an instrument development that they utilized for this QI project. It tells us about the phases and what they did with their training program, and then it goes into statistical analysis. So really quickly, I want to go back here. The citation, author's date of publication. Remember, that's all just a cut and paste. And the purpose of the problem, and I address that in the article, but it's really what this was about. The problem was nursing barriers that they wanted to discover, look at nursing barriers and address them in the ICU. And what the problem was with these barriers and why they weren't really implementing early patient mobilization on these patients for improved outcomes. So the purpose was overcome the nursing barriers and improve adherence to the ICU mobility by developing and implementing an evidence-based practice ICU mobility training program. The clinical question I did put in there, sorry about the dogs as well. The design and the method. The QI project, it ran from October 15 to February 16, and there were 3 phases of the project. They had a pre-test, immediate test, 8-week test. So again, just remember that even though they're doing pre- and post-intervention, that doesn't mean it's a quantitative study. Okay, so this was approved. I talked about that, who it was approved by in their committee. Their population and their sample setting, it was all patients admitted to the 10-bed CICU during the data collection phases of pre- and post-training. So the QI, the patients were N53 and they had post N50, but the RNs, they had part-time and full-time because we are looking at RNs as well, and they had N27 and there was no exclusion criteria. It's just whoever worked on those given days. The major variables were nurse barriers. We had mobility training program adherence. What I do sometimes if I'm confused, which is often, I will take the question. So will a specialty specific ICU mobility training program, that's a variable, you're independent, reduce nursing barriers, variable, outcome, and improve adherence with the ICU mobility, and that's another outcome variable, okay? So the measurement of the variables, when we looked at the article, they did develop their own instrument, and I just mentioned that briefly, and they had a little presentation. Those were their instruments as well, with handouts for their training. They developed an algorithm, and they had their pre- and post-test. And interesting, they came up with 3 major themes for the barriers, which was knowledge deficit, fear, and lack of resources for implementing early mobilization. Okay, their data analysis, I want to go back to the article very quickly. The data analysis, look, we have statistical analysis, and I love this. And it gives us a quick rundown of what it is. This is a, so if you want to talk about it, it really is descriptive analysis, meaning it's exploring the data, and it's telling us what the data says at a lower level per se. It's not like regression or t-tests, things like that. So these guys did do a Wilcoxon signed rank. They used that statistical test. They compared some means using that. They did box plots and whisker plots, which you'll learn all about when you get your, or that you maybe should be familiar with from a statistics class. They talked about, oh, they had Fisher's test, right here, Fisher's test as well. So these are all just different tests that they could implement to explore their means and what was going on. And they use SAS. That's a statistical program like SPSS. There's SAS out there as well, which is a good program. And then they go into the results here, but let me go back. So what they did was descriptive statistics. They had percentages. Box plots, I mentioned that. Wilcoxon signed rank. They use this to compare the means of the score. And they had the Fisher's exact test, and that was used to compare mobilization rates at baseline, post-intervention, and they used SAS, okay? So they did some pretty good tests in this. This is actually called non-parametric statistics, and you probably don't care about that at that point, but that's what it was. So the findings. Findings were clearly discussed in this article as well. They have the results, and I love tables because it really helps. And then they go on to discuss findings here. And the discussions are, they are the meat of an article. And they really explain what it is down and dirty, what they found as well, and what their limitations and what the strengths were of the QI project as well. So just putting it in here, what they found was a statistical significance. They found differences in the mean test scores from pre to post, and the P was definitely significant as evidenced by this P value. And they also, the pre-test to the 8-week test, there was some clinical significance also found when they talked about comparisons. So in the end, the mobility training program improved knowledge, and it decreased fear of mobilizing patients from the nurses. And there was a 78% compliance to the protocol and decreased patient bed rest. In other words, they were getting them up and at them earlier. 78% may not be like, oh my gosh, there should be 100%, but this was a whole brand new project and nobody had been doing that, so they really stated they thought this was a pretty good number. They did notice after 8 weeks post-intervention that there was a decrease in knowledge, but it was not considered clinically significant. I don't think the means, they talked about it, but the mean scores didn't change that much, okay? So strength of the program, the strength was success due to the inclusion. I think also what they had talked about was the physical therapist. Those folks is all work in collaboration with the nurses, but also there was support from the leadership, meaning the unit manager, the medical directors, and staff, the nurses. The limit, small post sample, because that's pretty patient dependent based on who's going to be in the unit at that time when they were in that certain phase collecting data. The biggest thing too is the pre-test, post-test. It wasn't validated. They should have probably done a little pilot, but they didn't. And I get that. Sometimes time does not allow us to do that, or money. But anyways, do I think that this is feasible in an ICU? Absolutely. I think what they found was that it supports early mobilization, but what we know from this study, if you wanted to do something like that, you could address the flaws first, and you could even do a little mini pilot study on your test, on your survey. The level of evidence was AACN was D. Let me just quickly go back to this. So the article, and it did talk about that. The project had several limitations, and it discussed about them. These guys did a really nice job writing this up, and they also talked about their strengths in here, which I can't seem to find. And then the conclusion, they had a nice conclusionary section as well. So just know there is a difference between quality improvement versus research. Okay, thanks.